Okay, everybody should be here. Well, hello. I am Lance King. I'm the Vice President of Sales at Healthcare Compliance Solutions, Inc. And if you're watching this, it's because you have recently sent in a resume. We've received nearly 300 in the past few days. And so we felt that rather than call each of you one by one, we'd make sure this is something that you're really interested in. And if you're watching now, it's because you want to learn a little bit more about the position. Want to first start unpacking who I am and talking a little bit about my motivation for being a part of Healthcare Compliance Solutions. So I live in Salt Lake City, Utah. My wife and I have 3 little girls. The picture that you're seeing to the right of me is our youngest daughter, Malia. Now, Healthcare Compliance Solutions. What would motivate someone like me who is extremely fitness oriented? My past is one where I did a lot of, I was into bodybuilding. I've had a side business where I've done exercise videos for health products, using their health products. A lot of people, including myself, suspected that might grow and that might be the direction that I go. But there was a time when things really clicked in terms of why Healthcare Compliance Solutions would be such a big part of my future. And it was when Malia got really sick. She was life flighted to Primary Children's Hospital in Utah. And at Primary Children's, we learned that she had RSV, a very common virus, a few years ago, and contracted a couple of other things, the adenovirus and the rhinovirus as well. Well, while we were at Primary Children's, one of the most amazing facilities, I mean, this place is just known across the United States. And those of you that are watching are from different areas of the United States and have probably heard of Primary Children's. Well, while we were waiting to hear kind of what the timeline of events would be for my daughter, my wife, who had worked in the operating room as a nurse for several years, mentioned to me that it didn't seem like a lot of people were wearing protective equipment. Personal protective equipment is what it's called technically. And what that really means is people would work with another patient and then they would come into our room and maybe be a little bit casual about putting on some of their equipment. So this became something that alarmed my wife's Linda. It alarmed Linda, and she actually mentioned to a couple of the individuals who weren't putting gloves on every time. They weren't covering their clothes every time. And it was a concern because with the sicknesses that she had contracted, we were just really worried that she might have something else happen to her. Well, over time it did. In fact, she ended up getting pneumonia. And the pneumonia got to where lungs began collapsing. There was a lot of fluid around the lungs, and her lungs just couldn't take everything that was going on. The nurses and doctors couldn't give us a diagnosis of, or I guess, what is it, a prognosis? How she was going to turn out, and they couldn't tell us whether she would even survive as a result. So this was something that really heightened my sense of awareness of how important it is for doctors' offices to have patterns implemented into their practices that help protect the patient. If you talk to doctors and healthcare providers, and if you've worked in those industries, you'll hear over and over again that their why to get into healthcare was to care for people. And the problem I've discovered is that many smaller practices, while they care greatly about their patients, oftentimes compliance is neglected greatly. And so across the United States, I'll just say this right now, I guarantee the last healthcare practice, well, I don't guarantee, but it's highly likely that the last healthcare practice you went to was not adequately protected with OSHA, which are the safety laws, the laws that keep people safe from chemicals, the laws that make sure that the machines are regularly labeled and checked and up to date, the laws that make sure the workplace in a doctor's office is designated for patients in one area and procedures in the next. HIPAA is the laws that protect our information. We give doctors everything. We give them everything. And what's happening is that patient information, because of what especially have been selling patient information, they'll hack into a network and they will slowly extract names and sell them on the black market for nearly $300 a piece because of what they're able to get. So we see finance industries, we see all these other industries with all of these security safeguards, these privacy regulations, and yet the consequences in those other industries are not even close to what we're seeing in healthcare. So there's a big problem, and we're out to provide solutions. Well, let's take a minute just to go through what to expect in this presentation. And again, thank you so much for making time to do this. This allows me to get a little bit more deep in presenting what's expected of our sales reps. But before we get into that, talking about who we are, who is Healthcare Compliance Solutions, who is our target market, what is the position, what is the sales process that if you choose to move forward, that you would be following or maybe following closely, adopting, and then adapting to your style, if you will. What resources will be available for you, what the pay structure is, and how to begin selling for HCSI. I have a few things that, if this works out at the end, that we'll take some steps toward the actual interview where we talk to you face-to-face if you choose to, through Skype or FaceTime, or just a phone call. Okay, so by the way, I'm opening this up in Google Slides. If you ever have to give a presentation and you need to go someplace else, it's great to take your PowerPoint, put it on Google Slides, and you can use it anywhere you want to, as long as you have internet. The only challenge sometimes can be, as you can see, the arrow has hidden market. So yeah. This is the target market. We'll call this individual Amy. So the target individual that you'll connect with is healthcare office managers and sometimes doctors. Many times so Healthcare Compliance Solutions, we serve healthcare providers all over the country. Optometrists and dentists, actually I should change the order, dentists and then optometrists, those are our top two customers. And I don't know exactly why that is, but our product is an online program, and I'll show you in great detail what it does for them, how it helps to lift the load. But our typical client is about an office of about 1 to 10 staff members is all. And honestly, a lot of the office managers that we talk to look just like Amy in front of you, just very happy, very curious as to why you're in their practice. Because typically what you'll do is you'll walk in and you'll ask for the compliance officer, and they think you're there to audit them. So these individuals, I'll just get into a little bit more about them. They are individuals who have many responsibilities. They wear many, many hats in a smaller office. And one of those is compliance, but oftentimes they assist with insurance negotiation. They assist with the phone calls. Many of them in a dental environment are also dental assistants. So oftentimes they're helping out with that. They are HR. They are just running the show, helping the doctor, and in many cases they're often the doctor's wife. So these individuals, when you consider compliance, well, it's really hard to get to compliance when you consider that we all have about 168 hours in a week, and if you consider if you look at the pitcher of water, let's say that's all that a doctor or a healthcare administrator has to give to their 168 hours in a week. Well, the first glass would be certainly patients is the first responsibility, then staff, then front desk, then accounting, and hey, why not have some fun? And as you can see, after everything is said and done, compliance really is the lowest there on the totem pole. Okay. And that's okay. Actually, that provides a phenomenal opportunity because our product, as I'll show you, helps to lift the load. See, these individuals are supposed to be compliance experts. If they're audited, they are expected to be the expert in the office, knowing how to implement HIPAA regulations, knowing how to implement OSHA, Medicare, and human resources. And we provide services for all of those. So what do many offices look like? When you get into the office and you begin discovering what they have in place. Well, I like this. I like this joke because in many cases, I went into an office yesterday, and they had patient files all over the place, and in many cases, they are quite disorganized in terms of how patient information is, where it's being kept, how it's being backed up, who has access to it is probably the number one issue. Most healthcare providers, when they get smaller, they just kind of assume that anybody can get into a patient record. Well, what happens if they know somebody that walks in? What's prohibiting them from opening up their record just to snoop around and see why they're in the office? Well, that's called record snooping. That's a breach, and that by law has consequences. So here's what is evaluated if a practice is audited. So in a compliance health checkup, at the very top, the most important thing is that there are policies and procedures that are documented, communicated, and updated on an annual basis. Moving to the right, we have ongoing documentation. Now, that includes forms. Many of you who just recently went to the doctor, you'll remember that you signed a patient privacy form, and to be honest, there are a lot of practices out there that have you sign those, and then they don't actually have anything in place to keep your information safe and secure. It's amazing. The other day I went to a pharmacy, and it's a pharmacy, I get it, but she had me sign this little waiver stating that I acknowledged that they were going to keep the information safe, and that they kept HIPAA regulations. And so I asked her, I said, well, do you mind if I ask what you do for HIPAA? What kind of things do you do to protect our information? And all she had to say is, oh, we have encryption on our emails, and we back up all of our healthcare records. And I mean, she could have just given 2 or 3 things is all, but she just shrugged her shoulders and said, honestly, Lance, I really don't even know. So ongoing documentation is critical. The next is training. Now, some offices will have some policies and procedures. Some of them will have training, but the misconception out there is that while many may think that they have training, it's not formal training. It's not training that covers all of what needs to be in a healthcare practice. It may be just don't share your passwords with other staff, and don't talk too loud when you're in a healthcare or when you're in the lobby area. I mean, just little things like that. But even then, even though they've got the training, they won't even document that they have these meetings when healthcare practices will get together to do things. So training is a really big issue. As you can imagine, they don't have the time to put something together. Sometimes they'll go to the websites, and actually, if you go to hhs.gov, which is the website you'll learn a bit more about HIPAA, you have a laundry list, huge list of all of the areas that a practice can be audited under HIPAA. And some of those are required for every practice, and some are addressable, which means that they're relevant for some practices and not relevant for others. So to put a program together can be really costly. Then you've got we go to seminars for continued education. And oftentimes the doctor is the only one willing to pay for that. Maybe he'll have the office administrator. But then they've still got to take that material, develop something that then suits the office's needs. So training is a really, really big issue. That's why there are a lot of companies out there. Business associate contracts. A lot of these doctors' offices, they work with several business associates. As you can imagine, a family practitioner, let's say a surgery center may have an anesthesiologist. Well, that anesthesiologist is a contracted hire. And so that individual will come into an office, and they will need to examine patient records, because certainly they're helping with certain patients and they need to understand how much to give, how much anesthesia to give. And so business associate contracts are required, which state that every practice must, every business associate that's contracted out must sign a contract that states that they will follow HIPAA, and that they have policies and procedures and compliance plans that they're implementing. The next is a risk analysis and risk management action plan. So every year there's a risk analysis that a doctor's office is supposed to review for HIPAA and OSHA, just to evaluate some of the holes. And then a security incident and breach management plan. If there is a breach, or rather when there's a breach, what do you do? So we won't talk too much more on necessarily the details, but I will just say 5 common reasons for an audit for a practice. First, disgruntled ex-employees. Okay, we have several stories where somebody was fired for one reason or another, and they report the practice to OSHA, and we have people that are now customers of ours where that's happened several times. And number 2, a self-reported breach. That's actually, by law, practices are supposed to report their breaches, and they have by March of next year to do it for everything that's happened this year. Number 3, employee activists. Number 4, patients' fear of breach. Okay, maybe somebody's getting nervous for some reason or another. Maybe they become distrustful of a doctor or one of the staff, or maybe they catch somebody snooping and they shouldn't. Okay, and there's several ways of finding that out. Social media actually is one of the one of the ways that that can leak out patient information. Random OCR visits. So OSHA or HIPAA could just visit a practice at random. Okay, and then this is just kind of a timeline. of what happens. So typically it takes about 90 days if a practice does go into audit. They're mailed a letter, then they ask for documents to be attached on a website that can show proof of different things like a security risk analysis. Then there's on-site field work, an audit report drafted, and so on and so forth. Okay, so that's where we come in. We like to say we make the pieces fit so that you don't have to. Healthcare practices have many things going on. And again, this is a very sore spot for them because they know they need to do it. It's the law, but making time for it is just really, really challenging. So we make it really easy for them. Okay, and I'm going to unpack just briefly what we do. And 3 simple ways we do that is through a membership, compliance binders, and then ongoing implementation support. What do I mean by that? So Medicare and employment law. And the nice thing about this is office managers, all they have to do is add staff, give login codes, and then they can track who has and hasn't done the training. And they're supposed to do this every year. After they've trained, certificates are printed out and they're put in the certificate binder. We also send them a reference guide and we send them compliance plans. Okay, these are done for them, done for you, compliance plans. And if they're ever audited, they'll just hand the binder, and we've had this happen. They'll hand the binder to the auditor, and then the auditor can simply review what has been done in the practice, and they're looking for dates. They're looking for ongoing documentation and signatures. We provide an implementation plan. Part of that is weekly and monthly updates. You're seeing a picture of our quarterly newsletter that they go through with staff. We provide phone and email support and a quarterly assessment. Every quarter we call our first-year clients, and we have an implementation schedule where we help them to understand what the most important things are that need to be implemented. All the customizable forms. And so that brings us now to the sales process. Okay. So we have practices out there that see this as a burden. Boy, if I was to put a figure out there, I would say about 85% of healthcare, smaller practices specifically, are not doing. You will be amazed, absolutely amazed. So here's our sales process. Okay, this is the one that I like to follow, and you're the sales professional. So certainly, if you find something that works, we recognize that we're going to learn from you just as much as you learn from us. Okay, so the sales process is such that you find or prospect for the offices in your area, and they're everywhere, right? You drive down the street and you'll see them everywhere. Then you meet the office manager, or rather the compliance expert. And so when you go into an office smiling, you'll say, I'm here to visit with the person responsible for your compliance. So then you meet the office manager typically, and we never sell standing up. So we ask if we can go someplace in private. And again, they think you're an auditor, okay? They have no idea. They've never even had anybody. You'll be the first person that's ever come into their office to talk about compliance. You'll sit down, and the first thing that you'll do, you'll see in the middle, I work based on a PAS approach, okay? Instead of presenting the solutions right away, we present the problem, A, the alternatives to that problem, which is often what they're probably doing, which is nothing, or S, and then S, the solution. So PAS. So you sit down and you talk about how that you're there because as a compliance expert, and maybe they'd agree that it's become very problematic to keep up with all the regulations, to train your staff, make sure everybody's updated, and to create compliance plans that are being implemented in an office. The alternative we've been finding with, in fact, we just learned from Redwood Endodontics and Redwood Pediatrics down the street that sometimes people go to seminars, some people will have a consultant, or some people just do it in-house. And all of those things can be either too expensive or even more time consuming. And so as the solution, we provide a solution that can lift the load, and we do what we can to support and make compliance as easy as we can. So then you get into the demo of how you do it. Okay, I'm here because I want to see if, like with Redwood Endodontics, if this would make sense for your practice. And then with the review, the beautiful thing is you'll be in their office most likely. We have either a demo that you can watch with them or go through with them. You may consider having some of our printouts that you just show them that are laminated. I keep that just in case. Or if they have a computer and they're okay, which I haven't had anybody say no that's actually interested in looking at the solution, then you'll review a test account online. You'll just say, hey, I want to show you what Redwood Endodontics is using. And so you're not going to get into Redwood Endodontics, but you're going to get into a test account. And then you're going to simply ask them about what they're doing. If they have a risk assessment for HIPAA, they'll likely say no. And so then you'll say, okay, well, this is what Redwood Endodontics is using, and you'll walk them through that. What about a risk assessment for OSHA? Then you'll walk them through that. What have you done this year for training? Okay, they do online training. This is what they're using. So you just go down these, there are about 5 or 6 tabs, and then simply present what they're using. I mean, it's the simplest review ever. Then you'll show them how people purchase. And then at that point, if they're the decision maker, invite them to give us a try. If they need a day to think about it or a couple of days, let them know we reward fast action. And for me, sometimes I take out of my commission $50, $100, and I'll cut that off the price if they're willing to move forward. So that's the sales process. You find people, you meet them, meet the compliance officer, you sit down, you talk about the problem of, as a compliance expert, it being really difficult, really challenging to meet the demands of compliance regulations. You discuss some of the alternatives of some of the people that you're talking to in the area, and you ask if it makes sense to learn about the solution that Redwood Endodontics is using, and then you demo the product. And the review button is you ask them in their own words to talk back, to share in their own words what you would be doing for their practice, which is providing a compliance portal with the training, with the forms, an ability to track who has trained, providing all the compliance plans, and an implementation plan. So the sale is, honestly, it is one of the easiest sales I've ever done in my life. Okay, I've done door-to-door sales. I've sold educational products. I've sold wedding dresses. Not as a distributor. I wasn't in a shop selling wedding dresses. If you've done that, that's cool. I've sold real estate. Refinancing. And this has been the absolute easiest and the fastest sale you'll ever do in your life. With the amount of money that comes with each sale. So we talked about a couple of things. How do you find the doctors? Well, there's a navigation app that allows you to plug in the healthcare practices around you. In fact, it'll have healthcare practices on the maps. And you can just add points all over the map with little pins, as you can see kind of down at the bottom where it says 22, 24, 25, 26, 27. And then you push a button after you've put in everything. It's the optimize button. And wherever you're at each day, because things can change, life can change. If you choose to visit with the practice, then you'll simply use a system like this to visit about 20 practices a day. Okay, 20 practices a day will have you seeing or sitting down with anywhere from 5 to 10 different offices. Okay, and if you sit down with anywhere from 5 to 10 offices, let's just say 5. If you sat down with 5 practices a week, then it's highly likely that you're going to have anywhere from 6 to 10 close in the month. And that is, I'm trying to be more realistic with that, to paint an ambitious picture. Well, you could close you could close around 15 accounts with that. So the reason to visit, okay, so you're going in there to talk to the person that's doing compliance. Well, sometimes, in fact, I've done this in the past. Recently, I haven't even found that it's just me asking if they're the compliance officer and asking if we can speak in private has been enough authority or enough of a reason to sit down. But if you need to, I have a risk assessment handy to say, well, I'm here. You may know Redmond Anadonics. I just did an assessment with them where we did a quick health checkup on their compliance program. We made some recommendations for them. And then we left this paper with the assessment, with the recommendations. And by the way, it's 5 questions, basically. You're asking if they have training, compliance plans, a risk assessment, a breach notification guideline. I mean, really just very, very simple things that you'd ask in your training anyway. And then you move into the sale. So you've got plenty of authority, plenty of justification for being there. Demonstrating and selling the account, I think the test account is the best way. Now, if you determine that face-to-face is just not something that you'd like to do, well, that's okay. You can do phone sales, and that's totally fine. But you'll still have quota, and so as long as it works for you to sell that way, to do just phone and email, and maybe social as well, social media like LinkedIn, then that's fine. Resources as far as branding, we have a bunch of flyers. So let's say after you sell, it's a we'll think about it. Well, you've got some flyers you can leave with them. One of the quote unquote flyers is a risk assessment. If you've done the risk assessment, one of them is just a piece of paper that has our pricing and breaks down what the product is. And so they're really, we try to keep this very simple. Those are really the only 2 that I would even use. And then as far as email, when you email, we have a demo that they can watch, or you can give them some information to look at a test account on their own. Okay, so what is the pay structure? And thank you for watching as long as you have. I really appreciate you watching. And so I'm going to get into some of the specifics. We have the program priced at $11.89, and that is the first year. And the first year is really when there's more of a structure. Every 3 months we call them and we do an assessment on their account. And then the second year on, they still do the training and they still get all the updates and they still get everything. But the first year is just kind of front loaded with things that they need to do to get everything set up. So the first year is $11.89, and then the second year on is only $3.50 plus the $3 per employee. Okay. Now, out of that, this pay structure, so we've determined that the best thing to do, something that's the most commensurate way for all that you're doing, selling out there, is 100% commission. And so 100% commission is $600 is what you would get for each sale. Okay, so that's a little bit over 50%, about 51% of the sale. So with 100% commission pay structure, and again, if this is a surprise to you, it was on the description of the job postings. $600 a sale to be for us. Quota is 4 sales a month. $2,400 though is pretty low. So to sell for a month, you may be visiting 10 practices a week and get 4 sales in a month. I don't know. I don't know what it would be, but 4 sales a month is quite simple, as well as 15 sales per quarter. But that's to keep your area. Okay, this is something where you'll be the only person that will be in your major city. I do a $100 gift card if somebody refers, and often I'll do $50 to $100 as a discount. So you've got to keep that in mind when you're selling. As a 100% commission, with 100% commission, you are 1099. And really the benefits of what we offer is, well, $600 per sale. So 10 in a month is 6,000. And if you're calling people, if you were to make 60 calls a day, if you're seeing practices, it would be, again, about 20 a day. And I think you'll be amazed. I think you'll be pleasantly surprised on how well this structure will do for you. So what's the next step in the interview process? Well, I want to know what your why is. It's fun to see how the why develops. My wife and I experienced some identity theft, and we're able to personally feel how frustrating nearly a year of our lives of trying to get this identity back because of identity theft. And identity theft is happening all over the United States. And the cause is, well, oftentimes people not doing HIPAA. And so having the security guidelines in place is super important. And at any rate, my why has developed in several different ways. And I just want to know what your motive is. Sometimes your why is that this is something that is challenging. Okay, if you're watching this, you're probably pretty ambitious. Ambition is really important. Let me also add that resilience is you can have ambition and be as optimistic as you want, but being resilient is, if you're not a resilient person, then this is something, this position will definitely give you resilience, where you may not have the best day one day. You may have some rejection, and you'll have a new day where you'll get a chance to start again. And that resilience will be tested. Your character will be tested. I recommend that you spend 30 minutes every single day reading. Brian Tracy says that's the fastest way to double your sales with a company. So I'm saying quotas 4. If you read 30 minutes a day, I think you'll surprise yourself that number will double and probably even triple. Want to hear about some of the resources? Well, I'm happy to talk on the interview a little bit more in depth on some of the resources. Really, I've given you a skeleton overview of everything that I use. And I also do use email, so we'll talk more about that. And I use social media, so we can talk more about that. Well, I want to know what your goals are. I want to understand your timeline. And these are some of the things we'll talk about in the interview. And so I will have my email address come up now. So if this is something that you'd like to pursue and move into the next stage of the process, lking@hcsiinc.com. And so let's talk and see what works for you. I hope that this has been instructive for you. I hope I've answered some of the questions that were posted on the Facebook page. I will post this on the Facebook page if you want to rewind things and ask further questions. I think that would be an excellent choice. I'm Lance King. I'm the Vice President of Sales. This is a presentation by Healthcare Compliance Solutions. Thank you so very, very much for inquiring about this position, and I look forward to connecting with you again soon.